Today on The Operators, we have Dr. Parisi, who was kind enough to join me. She's a dermatologist from New York who is a part of a very large MSO. And it was awesome to chat with her. Hopefully, you enjoy. So, every podcast episode, I always kind of ask this question of like, what's your journey from getting started in medicine to your current position that you have now?
Mm-hmm. Sure. Yeah. So actually started in private practice right out of residency, in a partnership track and serving kind of local community and kind of have stayed in that community. But my journey from private practice to a large private equity group, a large dermatology group changed about 6 years ago. I had a couple older partners looking to kind of retire into retirement and wanted to sell the practice. So ended up going from a small practice into a large organization, single specialty dermatology. So it was kind of a little daunting, going from a private practice to a large organization, at that point in time. But so kind of transitioned into a large organization, and it really have kind of grown, in many different ways since that time. Kind of grown into a position in medical leadership as a regional medical director for part of New York and Connecticut, and kind of taking a role in provider engagement, which is kind of a little bit of my niche. I am also a certified life coach and kind of transitioned into that as medicine kind of um, has led to a lot of physicians being unhappy in the field. So my kind of journey has been from private practice to a large organization, and really has kind of changed from just really concentrating on seeing patients to now really focusing more on culture and helping providers manage their lives and manage their practice. And how do you do that with a balance?
So, from like the life coach perspective, what was your
Yeah.
journey to becoming a certified life
Yeah.
coach?
Yeah, so I always kind of had an interest in kind of that. Our mind controls kind of all of what we do, right? You have these external boundaries within us, which is that inner voice saying you can't do this, you're not good enough, and then you have those external voices out there saying, yeah, you're not that good. So always been kind of interested in that, and kind of just my journey kind of seeing providers struggling with that balance, especially as a mom. I have four kids. So seeing that, trying to get that balance of I want to be a leader, but I have these four kids and I want to take good care of my kids as well. And where is that balance? And you've got all these at work, you've got all of these admin, this paperwork, this mountain of charts you have to do, and time you have to put there, and time you want to put for your kids, and how do you juggle that? So, kind of went into that journey of, all right, well, there's got to be, there's more here. So started a certification to become a life coach. Got my certification and just started my own business with my sister, who's also a physician, and kind of just focusing on providers. How do we thrive? How do we prevent that, that burnout that everybody's talking about? But more so, how do we have a sustainable career, and how do we tap into our own personal confidence and leadership, and really have that well-being that we all want, and that balance that we all talk about? But it's really, starts within us. And yeah.
So then, from a life coach perspective, where do you think physicians are burning out typically?
Yeah, I think there's a couple areas, and I think one is the staffing issue. Yeah, we had COVID and there was a lot of burnout then, but it's still continuing. And why is it continuing? Well, you have, it's hard to keep staff. It's hard to find staff. It's hard to keep them because it's a lot of work. Honestly, it's a lot of work for those, for any medical assistants. It's tough. So keeping staff, finding staff. So having enough staff to do all of the background work that we need.
Mm.
So it's staffing. It's, also all that background admin work. Okay, we need a prior authorization. We've got to get the prior authorization. That prescription is being denied. Insurance is denying this. Are we going to get paid? Gotta, get those charts done, have to get the tasks done, the patient callback. So it's all that admin work after seeing all those patients, which is really what you go into medicine for, right? We go in there because we
Mhm.
want to see patients, but then there's this all this other outside that you don't really learn about until you kind of get out and start practicing. And then we have a lot of patients, right? There we have that aging population that is just getting older. And we've got a lot of patients that want to be seen and they don't want to wait 3 months. They want to get in and they want to be seen. So, it's that staffing, it's the admin work, and it's the patient population. And those three that's a tough combination if you bring all three of those in, right?
Yeah, got it. Yeah, and I've heard that a lot of times. People saying just the admin work and running the clinic and RVUs and all this stuff is the
Yeah.
issue, but patient care is kind of the best part of the job for most.
Right. Right. Yeah. As a
So
physician, well, yeah, as a physician, you want to focus on that patient and give them the best care that you can as a physician, but you also have all of this background going on that has to be done. You can't ignore it. So yeah, it's tough.
yeah, how much of at your clinic are you doing admin? I know you're a part of like a larger organization.
Mhm. Yeah,
You're
I,
also a regional director, so it's kind
Yeah.
of like
So it's a kind of, yeah, exactly. So, as a physician, I would say, and it also depends on, is it your own practice? If you have your own practice, there's a lot of, you have to know how to run a business, which again, you're not taught in medical school. That's something that you come out and
yes.
a lot to it. But in a larger organization, yeah, we have a lot of support. So, but still we have limited staff because staff, it costs money. So a lot of my admin, I can, get if I have a good medical assistant, I can have some of that burden taken off me to my staff. So I can give them tasks to do. I can give them
Hmm.
callbacks to do. So, but, and, you still have, at the end of the day, and, if my medical assistant's scribing that note, less time that I'm going to have to spend on my note. So really the
Hmm.
staffing is kind of key. If you have good staff or you're using a scribe, an AI scribe, or
Oh,
you have technology, that's where, we're looking
shout out to Caesar
for
Health.
AI and tech to come in and help us is, okay, how can we relieve some of that admin work through all this technology that's coming out? How do we do that?
Hmm. Yes, of course, of course. So then at your clinic in Middletown, New York, like I'm curious, like are you a Middletown, New York native or
I I actually grew up in Dutchess County, so not too far from
okay.
here, about an hour, Millbrook, New York. So kind of similar area,
And the
but
clinic was
finished
was
right.
was
Yeah.
bought. It sounds like it was purchased, and then you kind
Yes,
of
correct.
just climbed up with that.
Yes, that is correct.
Got it.
Yeah. Yeah.
Okay.
Yep. Hmm.
So I was looking at on the website all of your things that you specialize in, and I noticed that cancer treatments is one. So like what do people maybe not understand about skin cancer and skin cancer treatments that you could sort of share?
Sure. I think, one of the biggest things people don't realize, and there's a lot of controversy over, is how important sunscreens are in preventing skin cancer. It really is. You use your sunscreens, it's going to cut down on your risk. And think
Mm,
people kind of ignore that, and there's a lot of controversy. How safe are sunscreens? But at the end of the day, we know that the sun causes skin cancer, and some of that skin cancer can be prevented by not going to the tanning beds and using your sunscreen. So sunscreens are important. I think that's really, really important. And the earlier we catch skin cancer, the better off. But the sunscreens, I would say that's my main thing.
and you wrote a children's book about sunscreen. What was kind of the
I
inspiration
did.
for that?
Again, I have 4 kids, so
Yeah.
the struggle is real. I mean, it's gotten better, but it was always a hassle. Trying to get the sunscreen on your kids, like, right? I don't know if you have kids, but they hate
I don't
sunscreen.
have
They hate
kids now.
applying it. Yeah, so that was kind of the inspiration and the importance of sunscreen and the importance of starting early can prevent a lot of that skin cancer, can prevent a lot of that aging, which just by using your sunscreen.
Hmm. So then, how does skin cancer get treated typically?
Yeah, so it depends on the type of skin cancer. We've got different types of skin cancer. Basal cell is being the most common type of skin cancer that we see, and typically pretty much harmless as long as you get it taken care of. We treat it in
Hmm.
the office, or we have a lot of times a Mohs, what we call Mohs surgeon, that can treat skin cancers of in certain areas like the face. Squamous cells, next most common. Again, as long as they're taken care of,
Hmm.
it typically don't lead to death, but can tell you my there's a little personal story. My mom just passed away in September. A
Hmm.
very aggressive squamous cell. In my field, it was tough to watch her. There was no reason for it, but it was an aggressive squamous cell in a non-sun exposed area, and it was incredibly eye-opening for me, both to see that skin cancer lead to her death, but also the system of medicine. But so there's basal cell, squamous cell, melanoma. So it really just depends on the type of skin cancer. They can be cut out. We can use cream sometimes to treat them. Melanoma is the deadliest type of skin cancer, so it's a little
Hmm.
bit more involved. There's also immune treatments now, immune blockers that we can use to treat skin cancer. So there's a lot of new medicines out there. So it just depends on type and where it's located for treatment.
Hmm. And then overall, like, would you say in your because you've been in dermatology for a while, like, have you seen dermatology improve with overall like medical treatments? Maybe the technology's improved.
Yeah, I mean, definitely overall, some of the treatments have stayed the same. We still use certain things all the time, but our treatments have advanced. Again, the immunotherapies, our biologics for different skin diseases, we've really come a long way. We've got a lot better treatments now for melanoma. We've got advances for even for squamous cell. We've got advanced treatments. So we do. It's come a long way, and it's continuing to develop and grow. And we can treat psoriasis better. We can treat eczema better. We have a lot of different immune modulators that really can treat these skin diseases now.
Hmm. So then that's good that you've seen the technology and some things progress. But one thing as well I wanted to ask about, which I always ask about, is like insurance wise. What's your thoughts on insurance and the current insurance flow in the United States? Have you ever had like a peer review experience or
I
anything?
have, yeah, I mean, I have. Insurances really kind of honestly, dictate what we're prescribing, how long we're
Mm,
prescribing it, to who we're prescribing, depending on your healthcare insurance. So, honestly, at this, stage of medicine, insurance companies are kind of dictating how we're treating and with what we're treating. I can tell you, daily I'll get a prescription rejected that's not covered or needs prior authorization. We have a company that we use to get
hmm.
medicines approved now because again, the admin time to do all of this work is incredible. So, insurance companies kind of are the key to a lot of these medicines, a lot of these treatments, a lot of treating diseases, how we're going to do it, and yeah, how quickly.
Why do you think medications typically get rejected?
One, there's a lot of algorithms for these medicines, and they're expensive.
Mm,
Again, you've seen a lot of the Trump just has his new medications that are trying to make them cheaper, but a lot of these medications, how they're priced, are extremely expensive. So the insurance companies are obviously trying to, they'll approve certain medications and not approve other medications, and some of this is just based on cost over anything.
so it's just cost. It's just business, as they say.
Exactly. It's just business. It is. I mean, medicine is business, right? And we all know that.
Got it. So one thing I wanted to dive into as well is your relationship with Doximity. You have this kind of somewhat of like a tech background. What did you do with Doximity, if you can
Yeah.
say?
So yeah, no, no, yeah, sure. I've been with Doximity for a while as a Doximity fellow. So what I do is kind of help them build out different tools for medical providers. So give them feedback. We did a lot of feedback on they have docs their own docs GPT, which
Hmm.
is they're for anybody can use it, but for anybody that has Doximity. So built that out with them by giving them feedback, by helping them say, yes, this works. No, this doesn't work. This is correct, not correct. And how can we make this better? So worked on that kind of tool. They also have their own AI scribe that kind of helped create and still kind of refining. They have Docs Dialer, which is an awesome tool for providers. Again, a lot of these tools are to help medical providers to make their to decrease the admin time, to decrease their burden, to give them tools to use in private practice or in medical practices, hospital systems to decrease their time that they spend on a lot of this stuff. So yeah, it just kind of helped give them feedback, give them suggestions. What do we need? Why do we need it? And it's been a great experience and continue to kind of help them continue to build out their different tools for medical providers.
And I know you mentioned as well when we were chatting before this podcast that you used the scribe. Like, what was it like to like what's your thoughts on using a scribe versus not using a scribe? I know it's kind of a dumb question, but
No, it's not a dumb question. I think as a medical provider, I think everyone is always asking, okay, yeah, we have medical assistants that do our scribing, but we're all looking for AI scribes. That's what we want. It would relieve a lot of the our it would make our lives a lot easier. It would make finalizing our notes easier. So we're all, every time I talk to a provider, when are we going to have a AI scribe? How long? And
hmm.
there's a lot of different ones. So it's finding the one that's going to work with your EMR system and that's going to work for you. But it would make life tremendously easier having an AI scribe.
Yeah, that's definitely the Caesar Health mission is to sort of AI for admin and make admin streamlined.
Yeah, it sounds that way. And I think that is, again, that is great because that's what we need. We have all this technology. How do we use it to make our lives easier, which is going to help, patients as well. So it's AI is here. Let's use it to, facilitate our lives and make it better and make it easier. So yeah, I love that. Love that that's part of your mission.
It's the Caesar Health mission. So, where do you think then healthcare with AI and with insurance, like dermatology, where do you think everything is going in the next couple of years?
Yeah. I think, dermatology again is one of those visual fields. So, AI is definitely going to help also, with diagnosis and treatment and getting to, more rural areas. You asked me if I was in a rural area, and I'm not, I'm more in a suburban area, but definitely have areas that don't have dermatologists, don't have medical
Hmm.
providers. So one, I think AI is going to help reach, that patient in that rural area. It's going to help bring more patients into the system. But I think in general, AI is just going to facilitate, um, you know, uh, our day to day easier, is going to facilitate, what we do and how we do it and help patients get in better and hopefully make the system um, a little bit more efficient.
And then where do you think you'll be in the next few years? Do you have any predictions for yourself? Any career predictions?
Oh, that's a great question. Love that question. At this point in time, I'm trying to uh, really I don't want to say my mission because it's not my mission, but really trying to help providers and medical providers mostly, again, with that work-life balance, that personal confidence. How do we communicate, and how do we get across what we need to communicate and have that sustainable career and that life that we all are looking for, right? It's not going to be the money doesn't buy it. You hear money buys happiness. Does it really? Um, does it really? I don't think it does, right? I mean, yes, money
Mhm.
does facilitate a lot of things, helps a lot of things, but the richest people are sometimes the unhappiest. Why is that? So, my part of my again, I'm not going to say mission, but part of my mission is let me help medical providers really find the career that they want and have that life that's fulfilled that they started to medical school for and are living that ultimate dream.
Yeah, and that's a good mission to have.